Scale items 5 and 6 assess arm motor movement and leg motor movement. For motor arm and leg scoring, make sure to appropriately position the limb. Extend the arms 90 degrees if the patient is sitting, or 45 degrees if the patient is supine. Always test the leg in the supine position by extending the leg 30 degrees. You score drift if the arm falls before 10 seconds as you count down out loud, or if the leg falls before 5 seconds. Begin counting immediately at the release of the limb. You should also count down with your fingers in full view of the patient as you count out loud, so that the patient receives verbal and visual input. You can help the patient in this item by placing the limb in the desired start position. Watch for an initial dip of the limb when you release it. Only score abnormal if there's a downward drift after the dip. Each limb is tested in turn, beginning with the non-paretic arm. When testing the arms, the palms must be down. Do not test limbs simultaneously. Do not coach the patient. Only in the case of amputation or joint fusion at the shoulder or hip is this scale item not scored. But you need to make a written note of this. On some printed copies of the NIH stroke scale, you may be advised to score amputation as a 9 when scoring motor arm, motor leg, or ataxia, but don't use the 9s in calculating the total score. You'll have to use urgency in your voice or pantomime to encourage the aphasic patient. These patients may understand better what you are testing if you use the non-paretic limb first. If the patient has restricted limb function due to arthritis or non-stroke related limitations, you still need to give a score. Use your best judgment to differentiate between the effect of the stroke and any other cause. Now let's lift this one up, and when I let go, you hold it up for 1, 2, 3, 4, 5. Perfect. Go ahead and relax. Now we'll try the other side. I'll lift it and you keep it up after I let go. Right there.
Okay.
1, 2, 3, 4, 5. That's great.
For scale item 6A, this patient scored a 0. For scale item 6B, the patient also scored a 0. Let's look at how this scale item is scored. Score a 0 if there is no drift and the leg holds the 30-degree position for a full 5 seconds. Score a 1 if there is drift and the leg falls by the end of the 5-second period, but does not hit a support such as a bed.
And you hold it for 1, 2, 3, 4, 5. Great.
Score a 2 when there is some effort against gravity, but the leg falls to the support within 5 seconds.
Tell her to hold it up.
Levántalo.
Up.
Así.
1, 2, 3, 4, 5.
Score a 3 when there is no effort against gravity and the leg falls to the support immediately, but the patient makes small movements such as hip flexion or adduction.
Now we'll hold this one up right there for 1. Okay, let's try it. Let's see you move it. All right, let's see you move that leg. Okay.
Score a 4 if the patient is unable to make voluntary movements.
Hold that leg up. Hold your leg up. Hold the leg up. 1, 2. Can you move it at all? Can you move that leg? Try moving that leg for me. Items 5 and 6 are the most reproducible of the scale and carry the most import in determining ultimate outcome. Please watch the limb very carefully and compare to a marker behind the patient to gauge whether the limb is drifting slightly. If it is not possible to test the patient on this scale item because of an amputation or hip or shoulder joint fusion or any other reason, the item is not scored. We discourage you from doing this in any but the most extreme cases, and the reason must be recorded on the form clearly. Patients scoring a 3 on level of consciousness 1A are scored 4. The test for limb ataxia, item 7, is an assessment for evidence of a unilateral cerebellar lesion. This test attempts to distinguish a clinically significant incoordination from general weakness. Perform the finger-nose-finger and heel-shin tests on both the right and left sides. Ask the patient to touch your finger with his index finger, then back to his nose, then repeat enough times to thoroughly test for ataxia. Then perform the test on the other side. Then test coordination in the leg. Instruct the patient to move one heel down and up the shin of the opposite leg. Give the same test on both the right and left sides of the body. Test the normal side first. Make sure the patient's eyes are open. In the event of a visual field defect, Try to perform the test in the intact visual field. The next thing I'd like to do is check your coordination. Take your finger here and touch my finger. Now touch your nose. Now my finger, now your nose. Now my finger, now your nose. Good. Now on the other side, I don't know what we'll be able to do, but see if you can lift it and touch my finger.
I can't.
Can't get up that high. Okay. Let's see what happens with the legs. All right?
Okay.
I'm going to take your right leg. I want you to put your heel on your knee and run it down your shin. Let's see what happens. Can you bend the knee? Put your heel right there. And run it all the way down your shin. And back up again. That's great. Now relax. Now let me try the right leg. I'll lift it up and you put the heel on your knee and slide it all the way down. And can you slide it back up?
I can't do
Okay. Put it down and slide it down one last time. Very good.
Okay.
For scale item 7, this patient scored a 0. Let's look at how this scale item is scored. Score a 0 if there is normal coordination. The movements should be well performed, smooth, accurate, and not clumsy. If there is significant weakness, assume ataxia is 0. Ataxia is scored only if present and out of proportion to weakness of the spastic limb. Ataxia is absent in the patient who cannot understand or is paralyzed, and so is scored a 0 on this item. Score a 1 if ataxia, dysmetria, or dysenergia is present in one limb.
I want you to take the heel, put it on your knee, and run it down your shin. Just take that heel and put it right there, run it down your shin, and back up. And now do the same thing on the other side. Put the heel on the knee, and run it all the way down, and back up. And run it all the way down to the end this time, and back up. And that's terrific. Relax.
Score a 2 if ataxia is present in two limbs, both arms, both legs, or an arm and a leg on the same side of the body. Also score a 2 if you observe dysmetria or dysenergia in both the arm and the leg on one side, or if there are bilateral signs.
So take this finger right here and touch my finger. Now touch your nose. Now my finger. Now your nose. Now my finger. Good. Let's try that on the other side. Touch my finger as quick as you can, and now your nose. Back and forth, back and forth, back and forth, back and forth. Yeah. There we go. Okay. I want you to take your right leg, put the heel on your knee. So lift this heel up, put it on your knee there, and just run it straight down your shin. Straight down the shin and back up. Good, good. Now switch sides and put the left heel on the knee there. Run it all the way down and back up. That's good. It's important to remember that this item is scored a 1 or a 2 only if ataxia is present and out of proportion to weakness. In the case of amputation or joint fusion, you may mark the item untestable, but make sure to write the reason on the form. Patients scoring a 3 on level of consciousness 1A are scored only if ataxia is present. Otherwise, give a 0. You test sensory perception with a series of pin pricks. Withdrawal from noxious stimulus is used in the obtunded or aphasic patient. Do not use any object other than a safety or seamstress pin. No paper clips, broken sticks, or ballpoint pens. Examine the patient with a pin in the proximal portions of all 4 limbs and ask if the patient feels the stimulus. The patient's eyes do not need to be closed. Ask the patient if there is any asymmetry between the right and left sides. Asking if the patient feels sharp or dull only begs for confusion and misinterpretation. To optimize reproducibility, ask the patient only to compare the 2 sides and tell you if there is a difference. In confused, aphasic, or obtunded patients, observe for symmetry of grimace in response to the noxious stimulus. Only sensation loss attributed to stroke is scored. Test as many body areas, arms, legs, trunk, and face, as needed to accurately assess for hemisensory loss. Do not test limb extremities like hands or feet when testing sensation, since the response may be confounded by an unrelated neuropathy. Unless absolutely necessary, do not test through clothing. I'll touch you on the right or the left, and you tell me if they're the same or if one side's sharper. Starting with your face, right, left, which one's sharper? Or are they the same?
About the same.
About the same, all right. Let's try your hands, right, left, which one's sharper, or are they the same?
Dollar.
Dollar on the right, okay.
Dollar on the right.
Let's try your legs, which one's sharper, or are they the same?
One's dollar on the right.
For scale item number 8, this patient scored a 1. Let's look at how this scale item is scored. Score a 0 when there is no evidence of sensory loss. Score a 1 for mild or moderate loss.
I'm going to test how well you feel this pin now. I want you to tell me if the right side is sharper, the left side, or if they're the same.
Okay.
Starting with your face. Which side is sharper?
Left.
Which side is sharper?
Left.
Left. Arms, which side
About
is
the
sharper?
same.
About the same? Okay. We'll go to the legs.
The left side is sharper.
Left side is sharper.
Score a 2 when evidence confirms severe loss. Only give a 2 when a severe or total loss of sensation can be clearly demonstrated. Patients with brainstem stroke demonstrating bilateral loss of sensation also score a 2.
Now I'd like to see if you can feel any sensation. I'm going to touch you with this pin. Can you tell me anything about that? Can you feel that? And I can't tell, so I'm going to try something else. I'd like you to tell me if you feel this, if you feel that squeeze. All right? Now how about on this side? Can you feel the squeeze on this side? Okay, and I can see you pulling back on that one. This item is never marked not testable. You should test stuporous or aphasic patients with vigorous noxious stimuli, such as nail bed pressure, and then decide between a 1 or 0 based on whether any response appears. Patients who score 3 on level of consciousness 1A will automatically score a 2 on the sensory item.